Okay guys, so in this video we'll be talking about syndromic management of STD. So this is a very important thing. It can be asked in the MCQ as the what is the color of a particular kit, how many kits are there, and like which drugs are used for. Those I don't think is that important. So we'll start with it now. Okay, so why do you need a syndromic management? See, it's better like when a patient comes with, if you give a wide Arizona, it's easier for the healthcare worker to treat. So it is relatively inexpensive, can be practiced even if they are less educated, and hence it also treat a wide range of sexually treated infection and can be provided by health worker at all the level. But what are the limitation? If the patient is asymptomatic, you won't treat because he won't come to the doctor. There is financial cost of over treatment, since in each kit there are 2 to 3 drugs, and there is chances of antibiotic resistance because the infection may be due to one organism, but we are managing it as a syndrome, so we don't know. Now, for which one of the following infection you don't remember partner management? So this is very important. This is not done for herpes. Now let's start with the kit. Okay, before that we'll see what organism causes what. If we talk about the urethral discharge, it is caused by gonorrhea and chlamydia. Okay, now coming on to the vaginal discharge, it is caused by candida, trichomonas and bacterial vaginalis. Okay, now coming on to the genital ulcer, it is caused by 3 organisms. So what are those 3 organisms? That is syphilis, herpes and chancroid. Now coming on to the next one, that is lower abdominal pain. It is again caused by 3 organisms: gonorrhea, chlamydia and anaerobes. Okay, now coming on to the inguinal bubo, it is caused by lymphogranuloma venerum and the chancroid. Scrotal swelling along, now this is also caused by gonorrhea and chlamydia. Okay, so now how do you remember it, what to give in what? Okay, so see, it's very simple. Okay, kit 1, just remember it as a gray AC. You can remember gray AC. Why I remembered it as gray AC? Because the drugs that are used are A and C. A is for azithromycin and C is for cefixime. Why do we give azithromycin? Because it acts against chlamydia, and cefixime for Neisseria gonorrhoeae. So it's done. Azithromycin 1 gram tablet and cefixime 400 mg 1 tablet. Start. Okay, done. Now coming on to the kit 2. Kit 2 is green. We know green is a veg food and veg food are safe. There is no risk of less risk of infection. So you can remember it as safe food. S stands for secondazole. S second means 2 gram. Hence it is used in dose of 2 gram. Then is the fluconazole. Fluconazole is useful for candida 150 mg. Done. Now kit 3, 4 and 5. All are used for genital ulcer. Then what is the difference? For genital ulcer we know there is 3 organisms. It is the chancroid, it is the syphilis and it is the herpes. Okay, so see, for chancroid and syphilis you use kit 3 and kit 4. For herpes it is the kit 5. Okay, remember herpes is, there are vesicles, it is the angry looking ulcer, hence herpes it is the kit number 5. Okay, remember. And for herpes infection what do we give? Remember the pharma, it's 400 mg acyclovir for 7 days. Okay, now coming on to kit 3 and 4. 3 can be made into a W, means kit number 3 is white. Okay, now kit 3 is white. So white is used for genital ulcers. So which 2 ulcers are remaining? That is caused by syphilis and chancroid. Okay, so how will you treat it? See, for syphilis, you inject benzathine penicillin in the dose of 2.4 million unit. Okay. Now coming on to the chancroid, you use azithromycin, azithro A first letter, again 1 gram. Okay. And here what you have disposable syringe. So how you can remove that? These ulcers are bad. B is for benzathine penicillin, A is for azithromycin, and D is for doxycycline. D is for disposable syringe. Sorry guys. Now coming on to the genital ulcer disease unit, patient are allergic to penicillin. So now you cannot give penicillin. In last kit we are giving penicillin. So we need to substitute a drug for penicillin. Instead of penicillin we will use doxycycline and we will use azithromycin. So what we give here? Here we use A and D, azithro and doxy. There D was disposable syringe. Okay. Now coming on to the lower abdominal pain, that is kit number here yellow. So how can yellow can be remembered as below? Okay, lower abdominal pain means below. Below sounds similar to yellow. So you can remember the color coding. This is basically this how I have remembered. This I have remembered that you bend down to collect the cash. That is cash depositing machine or collecting machine or how. C for cefixime, D for doxycycline, and M for metronidazole. So cefixime will act against Neisseria gonorrhoeae, doxycycline will act against chlamydia, and metronidazole for anaerobic infection. Now coming on to the next kit, that is kit 7. Kit 7 is black in color. That is inguinal bubo. Two organism causes bubo, that is lymphogranuloma venereum and the chancroid. So what will you use? Chancroid, we are again and again using azithromycin in same dose 1 gram, use it. Doxycycline will use 100 mg for 21 days. Okay, so guys, see, this is basically what I have taken from the government official website. Okay, so this is what I have said. Say in kit 5 you do not require a partner management. Okay, this is important. Educate the people to abstain for sex during if one of them has a ulcer or any other syndromic problem. Okay, provide condoms because it will decrease the risk of sexually transmitted infection. See, we follow up the patient for after 7 days for all STI, but in case of lower abdominal pain, means that was kit number 6, yellow color kit, ask them to come on 3rd, 7th and 14th day. Okay, and if the patient has inguinal bubo, okay, ask them to come on 7th, 14th and 21 day. Okay, then consider immunization against hepatitis B so that infection may subside. Hope this guys helps you. I have tried to simplify it. If you like it, please consider subscribing. Do like, share, comments.